Hi friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant fetal medicine. Today we're going to talk about a very, very interesting case. Okay, so we have had very, very pathognomic sort of a congenital cardiac lesion, right? And which is sort of an pathognomic, meaning thereby that the diagnosis would tell us that what exactly that we might be dealing up genetic abnormality in the fetus that outrightly might be dealing up with, right? But the question is this, that if we put the needle and look around for the amniotic fluid, what would be the percentage chances? So meaning thereby that at max it would be 40%. So meaning thereby that 40% it could be trisomy 21, but 60% that could be normal. So meaning thereby that non-invasive way, once we are doing the ultrasound, we have still not put the needle into the baby and we have not done the amniocentesis. So whether we can really sort of an triage, clinically triage, or probably can try to look around for other markers so as to see and we can get to more specificity as far as this ultrasound is concerned. Yes, definitely we can. So we try to look around for other parameters and then we identified one. And very, very astonishingly, we have identified one sort of an parameter that is very, very strongly associated to this aneuploidy. Right. So let us first see these slides and then probably we'll talk about all these things. So look carefully. This is a 20-weeker scan. So this is a complete AVSD, right? The septum primum defect, inlet VSD, complete endocardial cushion defect. So this is a atrioventricular septal defect AVSD. Now we see that both the right and the left ventricles are normal. We've looked on for the LVOT and RVOT. We've identified the obstruction is none, and then this is the 4D. So this is 4D how it is looking, right? So we can identify that this is a complete AVSD and it is a balanced AVSD. So we have not identified the hypoplasia of either of the ventricles and it is complete AVSD, right? So this is how it would look like. So we try to triage it by looking over the nasal bone. We identified that the nasal bone is also hypoplastic. So this could be Down syndrome, but at max that would be only 40% that in that case. But now this is very, very interesting that you look very carefully. We can identify this thick sort of thick doggy skin. Okay, so the accumulation of the dermal material, right? Okay, the extracellular matrix in the dermis, which is hyaluronic acid and proteoglycans and all those stuff. So thick doggy skin that in 4D would look like this. Okay, so this is a very specific sign for trisomy 21. Right, so trisomy 21 meaning thereby that it expresses the hyper expression of the dermal sort of an proteoglycans, right? So this is how it would look like. What we're identifying is an AVSD. It is an endocardial cushion defect. It is a complete and balanced depending upon the morphology of the both the right and the left ventricle. We did the cardiac survey and all those stuff, and we identified that there is no obstruction to the LVOT or RVOT, and then the concordance of the great vessel is also great, right? And so meaning thereby that probably we could have adjusted by doing this thing, that probably there could be 40% chance for an aneuploidy, and then probably we try to do some other sort of an clinical triaging non-invasive way to see for the baby. We identify the nasal bone is also hypoplastic, which is also can be there, and 3% 5% of the euploid babies, they can also have some issues with the nasal bone. I have told you in my previous videos also. Now, this typical thing, it is not a edema, it is not swelling, it is not fluid accumulation. So this is thick, dowgy skin, right, which is there and which is very, very classical for a Down syndrome baby. So the extra trisomy 21, the extra chromosome, makes it that the overexpression of the dermal proteoglycans is there, the degradation gets reduced, so proteoglycans are being accumulated, and then the hyaluronic acid and the codotin sulfate are being accumulated, and there could be delayed lymphatic sort of a maturation and fluid, all those things, and therefore ultimately it looks like to be a thick sort of an subcutaneous tissue and thick dowgy skin, right? Okay, so this becomes sort of a very, very specific marker as far as for trisomy 21. Right, so depending on all these things, so we are just clinically triaging the baby. So meaning thereby that the cardiac, nasal bone, and then the skin, they add on for the specificity of any non-invasive diagnosis, genetic diagnosis that probably we are trying to establish, right? Okay, so this is a very, very classical sort of an AVSD we have seen lot of them, but this is a very it is a fantastic AVSD, and it's central AVSD that we've identified. No element of an hypoplasia, both for the either for the left or the right ventricle, and absolutely fantastic. And secondly, is this the thick doggy skin to the fetus, right? Thank you very much for your patient listening.